Can COVID is an open science collective dedicated to rapidly mobilizing and sharing knowledge to help inform Canada's COVID-19 response. To learn more about us or how to join our community, you can visit our website at cancovid.ca.
Hi, everyone. Bonjour tout le monde. My name is Rob Steiner. I am an assistant professor in the School of Public Health at the University of Toronto, the Danisch School. Bonjour tout le monde. Je m'appelle Robert Steiner. Je suis un professeur adjoint à l'Université de Toronto dans l'École de santé publique ici. Today's presentation is actually going to be in English, but we have some simultaneous translation available, not some, but we have full simultaneous translation available in French. Alors, en français, je voulais juste, avant de commencer, me demander de partager quelques informations sur le déroulement de l'événement et pour la traduction simultanée en français. La présentation d'aujourd'hui se fera en anglais, mais nous présentons une traduction simultanée. Pour nos participants francophones, veuillez vous rendre au bas de votre écran Zoom où vous verrez l'icône d'un globe. Cliquez sur le globe et choisissez French si vous voulez écouter la présentation aujourd'hui en français. Et si vous avez des questions en français, vous pouvez les poser dans le Q&A. En forme écrite et je pourrais les traduire et les intégrer dans la discussion. Merci beaucoup. C'est le moment de sélectionner votre préférence linguistique. It's now the moment to choose your linguistic preference, and then we'll keep going with the event. So I'll give you a moment to do that. Okay, excellent. Welcome, everyone, to this discussion about public health misinformation, lessons learned and best practices, both across Canada and around the world. We have, as you can tell, a very exciting group of folks who've been at the front line of this question in various ways over the last 2 to 3 years. Let me tell you just very quickly how we will run today's event. We are going to go for about 50 minutes to start, 50, through the speakers, each in turn. Our first 3 speakers will speak as collectively for 10 minutes, and then we'll proceed from there. I'll introduce each speaker as we start. Our last participant, Gabby Stern, will actually join me in a bit of to start off the conversation with some thoughts based on what she's heard. And I'll be asking her some questions. And then for the last half hour, we'll move right into a Q&A. The questions, you can throw them into the Q&A chat that you'll have at the bottom of your screen. And I'll be watching that as we get through the discussion today. And I'll be synthesizing questions so that we can do that as efficiently as we can and bringing them. My own very quick background is that I'm a former journalist at the Wall Street Journal who's gone through a number of different iterations and now run the public health communications programs in the Danisch School of Public Health. And my COVID-related work was that I was a communications director for the Ontario COVID-19 Science Advisory Table. And in that capacity, also worked a fair bit with CanCovid. So that's enough about me. We will go straight away into our first group of 3, and let me introduce all 3 of them for the next 10 minutes. And I hope that our connectivity issues have been resolved. Norma Rabbitskin is a senior health nurse at Sturgeon Lake Health Center. So Sturgeon Lake First Nation is in northern Saskatchewan. For those of you who are not in Canada, Saskatchewan is obviously the big province right in the middle of our country. And she's a member of the Big River First Nation in Saskatchewan. She's a fluent Cree speaker. Dr. Vivian Ramsden is a registered nurse and a professor and director of the research division in the Department of Academic Family Medicine at the University of Saskatchewan. And Shirley Bighead is a Cree woman from Sturgeon Lake First Nation, where she currently holds a position of the director of health at the Sturgeon Lake Health Center. So why don't we just jump in? And I don't know which of you here, how exactly you want to do this, but why don't I, because I see Norma at the top, why don't we jump in with Norma unless someone else wanted to jump in first? And I'll watch time, so don't worry about that. Does everyone have connectivity? Norma, can you participate?
Good morning. Danse, Yadam Skadnak Akio, Sikason. Norma Rabbitskin from Working First Nation in Sturgeon Lake First Nation. I'm originally from Big River First Nation, but Shirley asked me to start. So we're honored to come and present virtually on our presentation on detecting and correcting public health misinformation, lessons learned and best practices in our Sturgeon Lake First Nation. I wanted to, can you just move forward with the slide? We are a First Nation that is situated in, you can move the slide, please. In Saskatchewan, and Saskatchewan is, we're right in the middle. We're located in Prince Albert, east of Prince Albert, north central area. And we have a total population of over 3,600, and on reserve is a give and take about 1,600. And then can just move the slide. I don't know if my health director there, Shirley, want to talk about our profile of our community and the services we offer, and then I'll continue on with our presentation.
Good morning, everybody. Like Lorna said, it's an honor to participate in the telephone conversation. I am from Sturgeon Lake, and I've been the health director for 30 plus years. I'm actually the only health director that Sturgeon Lake has ever had. So, I mean, that in itself is an honor. We have, for the first time ever, from May, have elected a female chief, and I think that's made some real positive impacts in our community. We have 6 band counselors. We have a number of programs and services that have been constantly revised to ensure that we meet the needs of the community. Insofar as COVID, we'll go into the statistics that will include the number of our membership who have actually come down with COVID, and the number of households affected, and our strategy to work with our community to minimize the impact of COVID. We have seven nurses that we're lucky enough to recruit and to work with us throughout the COVID pandemic. We lost 2 individuals, both with comorbidities and who were elders, one with cancer and COVID, actually both of them with cancer and COVID. But I think that through the efforts of the Sturgeon Lake Health staff, working with our chief and council, I believe we were able to minimize the more avidity, I guess, within the community. But we all work together as a team, including not only the health staff. It was a lot bigger than that, wherein we have an interagency team that includes all of the directors from the programs who, prior to COVID, met monthly to determine the best course to assist us to minimize the impact of COVID on our community membership. I think I'm gonna stop there for now and turn it back to Norma to get into the actual specifics of the number of cases. And the one thing I would like to say, while it's still in the front of my mind, is that when the government stopped reporting on a regular basis the number of cases, and when Northern Intertribal Health Authority quit collecting the data, we believed that we were going to have real difficulties in trying to continue to contain the virus. And we were pleasantly surprised by the number of individuals who contacted the health center to self-report. That wasn't something I was expecting. So through that process, we were able to continue to work with our community and I said minimize the severity of the impact of COVID. Okay, those are they serve as my opening remarks. I'm going to turn it over to Norma now.
Okay, thank you, Shirley. So as you heard, Shirley, we are a transferred community, meaning that we deliver first level services here in our community and manage our own community, hire our own staff. So we have the ability to design a health service delivery model that is that harmonizes both Western and traditional approaches to health and well-being, promoting, and we've been successful in retaining some staff to work on those particular main areas with traditional health. So in the next slide, when pandemic was declared back in 2020 in March, we implemented our holistic pandemic plan, and that was an interagency with all the programs, like the school, the band office, and social development, and all of the key components of where the community came together to respond to the crisis. We've had some valuable lessons learned, and that really we were really equipped to respond, and the community worked together to help with dealing with the crisis. So lots of the stuff that we're about to share is we didn't see our cases pick up. I know in Canada they were reporting cases in March, and whereas we didn't start seeing anything till October that fall. And that's where, as you know, that's when flu season begins. So one of the things that we have implemented as well was the security went up to manage the gates from east and west side of the community. And this is where we have the nurses, basically the health services took the lead role in managing and supporting and guiding the whole process and updating the chief and council. And this was, it was a struggle at first because the messages that were coming down from the national and in the regionally, it was really, we had to establish our own communication control center. And a lot of that was relayed through radio, informing the community about what's happening, and also interpreting in Cree with our language to calm the people. So we've also started implementing a lot of the coordination of establishing the community events and making sure we keep track who comes in and out. Logbooks were established, key tags were given to promote access of our staff that were coming in and out of the community. And we also have staff that develop these dashboards for the community to use, because we had to make every effort to relay the information visually and through the radio system.
Could you move the slides? Move the slides too. We only have a couple of minutes left, so move the slides.
So this is the cases that we wanted to show over the past 2 years. So as you see, this is where a lot of, we have about our population, like I said, was 1,600. We have 286 approximately houses that we have in our community. As you can see, over 2 years of the pandemic being declared in our community, we had about over 476 houses that were isolated. And then the total cases, actually, sorry, I gave you the wrong stat, is 501 houses that were isolated over the course of the 2 years. And we, at this time period of the 2 years, we had 476 positive cases over that period. So as you can see, that there was some isolations that were happening in the community, but those were outside people that work outside the community that were isolating. So those were related to, so if you were wondering why there's positive cases in the middle. But we are also keeping track of our community members that were living in the reserve. So next slide.
Norma, I'm very sorry to interrupt, but we just to keep us on track for all the other speakers, we have maybe just a minute left, if that's okay. So I don't know if we'll be able to get back to this in the Q&A as well. I'm sure I have a couple of questions that I want to throw out.
Okay, so this is the situation report that we developed, and it was available and it was posted on Facebook. So that's our little dashboard. Next slide. Yeah. So the Moccasin Telegraph shared was the most important. That's where to relay the information with Chief and Council, nurse telephones, and contact tracing we continue to do. And there's a lot of challenges in regards to the miscommunication that was affecting our community. And so the leadership chose to mandate that we continue to function as was before, with 5 days isolation and doing our self-monitoring and managing our own surveillance of the disease and infections. We continue to implement the pandemic plan. Next slide. Securities, these are the main challenges that we were struggling with. The security the people coming in and out, you can't really control that. The symptoms, the mainstream society was saying only the people where it's a lot of miscommunication, that they were saying that the weak immune systems, people with weak immune systems were going to be get sick fast and pass away. But our whole belief system as Native people, as Indigenous people, we rely on our own medicines as well, and relying good education and giving ownership back to the community to be self-reliant. So we did a lot of working with the families. A lot of the challenges was the information coming down to us with the vaccine and booster vaccines, and our community was given the Pfizer. And so there was challenges with that, the slow uptake. A lot of the miscommunication was scaring people away too. Quarantine, there was a lot of misunderstanding about quarantine and isolation. Our people was really struggling with that as well to understand. So what really we did was we did our own information in English and Cree to relay that information. Testing was overwhelming at the beginning, and we are one of the test sites for PCR and also with GeneX. We made that available in our community, and we're still providing that test, even though there's a lot of the testing is not available regionally. The houses, well, traditionally, your nucleus family, the usual definition for that is 2 parents and 1 child, or 4. But when you're living in the First Nations, it's not your standard definition. We have a big kinship system. We have a lot of families that are living together. Overcrowding is an issue. So, and there were some of the things that we have understood from, we were experiencing reinfections, and that will, Vivian. Go ahead, Vivian.
I'll just move to the next slide and then we're finished. Thank you. Thank you very much for the opportunity to be here.
Vivian, in a minute or so, do you want to speak to this and the importance of this?
Well, having been an ally with Sturgeon Lake for a number of years, the biggest thing is to actually help them to answer their questions in ways that are meaningful. And so we've just actually finished a CIHR grant to look at whether or not overcrowding makes a difference, and whether or not the same houses that had mold and or smoking in the house actually made a difference to the number of COVID cases. And it was interesting to find that at this point in time, they're not statistically significant, but there is a risk. The higher number of people living in the home, certainly the number of people are more likely to contract COVID. Thank you.
Thank you. And I think that last point is a critical point, not only in working with Indigenous communities when one is not Indigenous or coming from outside of those communities, but also I think generally as a general principle for communications into any community or with any community. So I want to, there are a number of questions that are coming from this. This was actually fascinating. So I'm noting questions coming in, but let me move now to Robert Danisch. Robert is in the Faculty of Arts at the University of Waterloo, which is in southwestern Ontario. He teaches courses in communications, ethics, speech writing, persuasion, small group communications, public communications. His research interests concern theoretical or rhetorical theory and public communication within democratic societies. He's author of many books, the most recent of which is Beyond Civility, The Competing Obligations of Citizenship, and also a popular book on improving communication skills called What Effect Have I Had? Professor Danisch also hosts a podcast called Now We're Talking. So let me turn over to you, Robert, and take us through your thoughts.
Great. Thanks so much, Rob. I appreciate it. And I appreciate the opportunity to be here. I just want to say I'm going to use my 8 or 10 minutes here to be intentionally provocative, but I do that with a very kind heart. Those of you that are listening from the healthcare professions, you have my deepest respect for the labor and the work that you had to do on the front lines of this pandemic. I'm a communication scholar, so I can sit in the sidelines and offer analyses and criticism, but I was not treating patients, etc. So you do have my deep, deep respect for all the work that all of you did. But I am a communication scholar, so I have 2 things to say in my 10 minutes, one very broad thing and one slightly more narrow thing. As a communication scholar, when I talk to people that are not from my field and a diverse audience like this with different epistemologies, different orientations, I like to start by talking about what communication is and what it isn't, because there's a deep misunderstanding around a lot of people about what communication is. So, and my provocation is in part a criticism of the entirety of the way this panel has been kind of organized and thought through, and the way the entirety of pandemic communication was thought through. So in communication studies, we have a distinction between what we call the transmission model of communication and what I'll call in a second the rhetorical model. The transmission model of communication assumes that me as a speaker is transmitting information from inside my head to your head. So it assumes that the problem of communication answers the question, a shorthand question, did you get it? Did you get my transmission of information from me to you? And I think a lot of the COVID pandemic work around science communication thought about it like this. We're transmitting information about COVID to the public. So for example, which I'll talk about in a second, masks. Masks reduce transmission. That's a bit of information. The public health officials try to transmit that information to an audience. If that's how you're thinking about communication, you're doing it wrong. That's a really bad understanding of communication. It's totally inaccurate. It's not helpful, and it makes science communication, at least, much harder and much worse. If we're not transmitting information, what are we doing in the communication process? What we're doing is making meaning. So communication, hold on, let me take a step backwards. In the course of the 20th century, one of the great achievements of human civilization were technologies of information transmission. So we're able to have this Zoom call because technologies of transmission kind of work so well right now. They can transmit information from my computer to your computer. It was a massive revolution in human civilization. And for some reason, humans started to think that the human problem of communication was the same as the technical problem of transmission. In my field, when we use the word communications with an S, we mean that technical problem of transmitting information. And when we use communication without an S, we mean the human problem of making meaning. So I'm interested in making meaning. And if I think about, I taught persuasion for 25 years. Persuasion is really the strategic art of assigning meanings for the purposes of motivating action. So how that works is really much, much more important than the transmission of information, at least in my view, and everyone else I know in my field thinks of it that way also. So let's talk about masks for a second. Here's the problem, right? Masks work to prevent the spread of the virus, and you all have the data to prove it. So Dr. Tam or Dr. Fauci or whoever believes that if they just get that information to the public, their job as communicators is done. But information doesn't motivate action. And that as a description of communication is inaccurate. So what do? Okay, anytime you introduce a new idea or a new object into public culture, you have a contest over the meaning of the idea or the object. That contest over meaning is inevitable. So think about, for example, hockey. So I'm using a Canadian example. Helmets in hockey. For years, people thought helmets were a sign of weakness in hockey. And they were kind of a problem because hockey players are supposed to be tough and macho. So the NHL had to fight the meaning of helmets in order to motivate players to wear helmets. So now we don't think of hockey players wearing helmets as a kind of weakness. We think of it as kind of common sense. So meaning and information are not the same, and we make a mistake if we assume that they are the same. We also make a mistake if we assume sharing information is all that we need to do in the process of communication. It's not. You're doing it wrong if you're just sharing information. Meaning is actually an outcome of communication processes and practices, and it's shaped by the kinds of connections and associations we make through language. So I think of effective communication as an art of managing and making and remaking these connections and associations. And we have to remember that meaning is not kind of a taken for granted, already existing property of an object or an idea. We make meaning in communication. In other words, meaning is an outcome of a set of communicative processes. So let's think about the case of the mask for a second again. Masks get introduced. There's a contest over the meaning of the mask. For some people, mask meant weakness, femininity, governmental overreach, infringement on personal freedom. So a Fox News host tweeted, "Might as well carry a purse with that mask, Joe," about Joe Biden. Clearly, that's an attempt to make mask wearing mean weakness or femininity. In communication studies, that's called semiotic tying, when we associate one object, the mask, with another, the purse, in order to suggest that people should relate the meaning of the one to the other. That's how persuasion works. So Trump believed that masks meant weakness. That's why he refused to wear one. And his administration tried to strategically tie mask wearing to weakness by suggesting someone that wears a mask is not tough enough to take on the virus. And if you were to have explored right-wing media for a few minutes, you'll find the communicative labor of tying weakness to mask wearing. Here's what we know. Meaning motivates action. Information doesn't. So the statistics we receive about COVID infections do not change behavior. They don't motivate action. So if Dr. Tam or Dr. Fauci want us to see masks as necessary instruments of public health, and if they're going to work, we need to motivate people to wear them because of what they mean. And in order to achieve that, we would need skilled kind of communicators that tie the meaning of mask wearing to values that can motivate action. That's generally how communication processes work. Instead, we got Tam and Fauci and others sort of explaining what the function of the mask is, so information transmission. And then every press conference they did, they offered us more information, and that was a missed opportunity to participate in the contest over making meaning. If we did wear a mask, we probably did that because the information we got was from doctors, and we trust science. We already value or assign meaningful values to science more generally, and that's why we're able to be motivated for action based on scientists' thoughts. But if we do the labor ourselves of associating masks with other kinds of health and safety measures, fine, but that's not a available option for all of the population. Okay, so those people that rejected mask wearing, they were motivated by affective feelings of toughness, kind of derived by the associations that Trump and others forged. And our government didn't offer a competing, patriotic, uplifting set of associations that would have motivated action in the same way. We had this slogan in Toronto for a bit, "We are all in this together," and I thought that was actually the kind of slogan that could make meaning, but then we dropped it. So people make decisions who to vote for, whether to wear a mask, not based on reasonable calculations around information. That's not how communication works. They don't think to themselves the mask will lower the probability to get the virus, and therefore they should wear the right one. Instead, people need to be motivated to action, and that happens through feelings derived from values and meanings. So those are kind of my two provocations, and I think I'll stop there. If you're practicing communication as the transmission of information, you're doing it wrong, and it's going to work out poorly. If you think about a case like mask wearing, the job was to assign meaning to the mask, not just transmit information about what the mask did in the course of preventing the transmission of the illness. I think some others in this panel will also talk about values and stories, et cetera. Those are communicative mechanisms of creating meaning that are really, really valuable and really, really important. And those opportunities, I think, were widely missed in the pandemic. Okay, so I'll stop there. We're back over to you, Rob.
Robert, thank you very much for that. We'll stay in Waterloo, so in Southwestern Ontario, and we'll go now to Dr. Ashley Rose Mehlenbacher. Ashley is a Canada Research Chair in Science, Health, and Technology Communications at the University of Waterloo. She was the winner of the 2020 Fellows Early Career Award from the Rhetoric Society of America. Her work combines rhetorical studies in science communication to investigate key issues around expertise, around trust, around mis, mal, and disinformation, around risk and ethics of communication in complex situations. She's the author, most recently, a book called On Expertise, Cultivating Character, Goodwill, and Practical Wisdom. Ashley, over to you.
Thank you. All right. So I guess in some ways, I'm really going to pick up where Rob just left off. So if we could advance to the next slide, and then the next slide, please. Thank you. So where I really want to start, and I'll keep this brief. So my slides are a little text heavy, but think of them as resources, and I'm just going to kind of talk generally around them. But when we think of something like the transmission model, we can also in science communication talk about the deficit model. So this is, again, that idea where you have some information, and if you give it to folks, they're going to have the right information and be able to make good decisions based on the science, and that's sort of the job we have to do. We know that doesn't work. We have decades of research that shows that doesn't work. But there are other models that we can look at that help us communicate science effectively, including things like the contextual model. So I won't get into all of this, but when we look at any of these examples, including when we think about strategies like science literacy, what they all require is a very complex understanding of situations and of various kinds of literacies and information, and also meaning and values that we're going to need to bring together in conversation, especially when we think about things like misinformation and sort of where it's playing to. So when we think of even, for example, science literacy, we really need to think also about civic and digital literacies, mindsets and biases and this sort of thing. So there are also kind of pragmatic interventions, such as, really getting folks involved in things like citizen science and the process of science to really understand how, science itself has processes of meaning making, right? There are ways you argue as a scientist. There are values that you have as a scientist. So sort of opening those up and bringing them into conversation is a really important way to start sort of unraveling some of that complexity. So if we go to the next slide, please. When we look at this from a rhetorical perspective, so I'm also a rhetorician, really some of the issues that we're looking at are things like the context, the particular audience, the particular purpose of our communication. So each time we're developing communications, we really want to kind of bring those very specific questions to what we're doing in our work. And when we look at things like media, which is a conversation that comes up a lot, especially around misinformation, right? Is it being spread on social media? Where are people finding this stuff? We also need to think about things like genre, or the kind of typifications or forms of text that are in these environments. So for example, even if we just think of Twitter, not all tweets are sort of the same, right? So we have things like the tweetorial, so we can use it to help counter misinformation. But it can also, of course, as a media, be used to spread information, and things like genre are really important to understand some of the nuances of how that's happening. And in rhetoric, we also talk about, as Rob alluded to, so we talk about ethos, logos, pathos, but these are really sort of very basic principles that give us the idea that character matters of the speaker, of the sort of range of speakers or institutes or whoever is sort of representing the messaging. People have reasons. They're not necessarily, we don't want to just think of logic in a very simplistic sense. We want to think of good reasons. What's the reason motivating the audience? And then, of course, emotion in a responsible way, right? Not in a deceptive way. So misinformation often invokes fear in people, right? But we can also think of good emotions, right? Like we wear masks to help and protect others. So these kinds of messaging can help counter some of that. So if we could go to the next slide, please. So when we think about crafting some of these messages, again, it's when we think about that, as Rob said, the transmission model or deficit model or that sort of thing, part of the way we can counter that is really sort of talking to folks. And that is part of, so I've also worked as a technical communicator. So one of the things we have to do, right, in communicating technical information, just like scientific information, is really kind of distill some of the information, but also really connect it to what people are trying to do or what matters to them. So in these sorts of approaches, there are various strategies that we can use. So part of it is also just talking to the folks you're trying to get the message out to, right? And I realize that in sort of time-sensitive situations, that can also be very difficult. It can be resource intensive, but approaches such as focus groups or short interviews can help you really, especially when we think about misinformation, catch stuff early and address that. So when we think of all of these approaches, and I've sort of listed them on this slide, part of what we're really trying to do is start a conversation early so that the messaging isn't just that sort of push, unidirectional push of information out. So if we can move to the next slide, please. Okay. So for misinformation specifically, some of the challenges are we're really talking about a lot of different things going on that are contributing to what we're calling misinformation. Now, in some cases, these can be the values folks are bringing to a conversation. It can be things like partisan politics as well. It can be sort of mindsets or existing frameworks, but we also have what I've talked about here is confounding factors. So understanding what preprints are and how these sorts of changes in science communication are being pushed into a more public sphere through, for example, journalism, is a really difficult challenge for folks to kind of untangle and understand. So part of the work around that is also helping folks understand how, again, these processes of science make meaning, and this sort of consensus-based approach as opposed to, singular studies. There are also challenges in issue fatigue, in social media sharing algorithms, and these are covered quite often, right? So we sort of know what these are. But we also have interfering factors, including predatory publishing, scams, frauds, conspiracy theories, extremism, and I'll talk about those a little bit more in the next slide. But in all of those cases, these are also contributing to misinformation. So again, one of the issues that we need to really think about are the sort of situated ways in which this is happening for particular audiences. So some of the solutions, and I put a question mark here because I think we're really sort of exploring this because it is a changing situation, and we see different forms of misinformation on different platforms and different genres coming out. But in some ways, we know that using subject matter experts to address some of the challenges in messaging and also communication experts is a really effective approach, right? So we can get that the sort of scientific information, but also then, as Rob had said, connect it to values, right? We also know that we need to amplify the messaging because misinformation it's packaged to be engaging, right? So it gets a lot of uptake. And we know there are various sorts of computational approaches and identification of key nodes and that sort of thing can be very effective. But if we move to the next slide, please. I think one of the ways we need to dig into what's happening is also looking at disinformation. So that is the sort of intentionally misleading or sort of bad faith representation of information. So we can see this as misinformation or malinformation. So sometimes malinformation is talked about as, it has some kernel of truth, but it's information or something that's not represented particularly well. So this can also, when we talk about disinformation, include propaganda, right? So we can have actors from other states spreading propaganda. It can be internal, so there are various kinds. So when we look at this kind of thing, we know that social media hasn't created this problem, right? This is a really old problem in the rhetorical tradition. So I study in the Greco-Roman tradition, which is, more than 2,500 years old, right? We know these kinds of problems have existed for a really long time. And we know that they're tied into and connected to things like conspiratorial thinking and extremism. And we've seen recently, I think, that is a increasing concern. So I think in those ways, whether we're talking about misinformation or disinformation or the malinformation, the kinds of whole government approaches are really important, because when we're looking at a communication problem that suddenly has features of extremist kind of response, we're sort of moving outside what even just communication practitioners can do. And we've seen this in the responses to public health officials, both in Canada and the United States. So here, what I've sort of posited as potential solutions, and I think Heidi next will talk a little bit about this, but is almost more getting on the offensive in thinking about some of these problems. So we have a lot of public health experts, And I can not begin to imagine how exhausting a lot of this work has been in trying to communicate messages out to the public and engage the public. And a lot of them have sort of faced various forms of extremist backlash, right? So, and we can think about that because some talks about, there's a mindset, but then this also can move into behavior. And we know that, for example, folks have had to get security, right? So thinking about frameworks for helping folks who are targeted can put us on the offensive so that we don't have to immediately respond to whatever the kind of particular targeting is without any resources. So I've given the example here of the universities of the Netherlands, and they're starting to think about some of the approaches that they can use. They have a framework for journalists, but also for academic scientists, public health officials. And we know that this is also not evenly distributed, right? So for example, women have been targeted. Their data shows this as well. I think we've seen that in various high-profile public health cases or public health experts cases here. So really, again, that kind of offensive measure, having framework support resources for the folks doing that work, I think is really important. And I'll just wrap up by saying that I think all of this, again, reminds us that it's very situated and depends on the case. So thank you.
Thanks a lot, Ashley. I could see how we are actually sort of diving down and how these two presentations, the last two presentations, really built on one another. So let's move to Dr. Heidi Tworek. Heidi's a Canada Research Chair and Associate Professor of International History and Public Policy at the University of British Columbia in Vancouver. She directs the Center for the Study of Democratic Institutions. Her work examines history and policy around communications, and in particular, the effects of new media technologies on democracy. She's Senior Fellow at CG, the Center for International Governance Innovation, and she's a non-resident fellow of the German Marshall Fund of the US and the Canada Global Affairs Institute. Her book of particular note is News from Germany, the competition to control world communications between 1900 and 1945. So I don't know if that is a model for what we've been experiencing recently, but certainly those are insights that have defined Heidi's work. So Heidi, over to you for about 10 minutes.
Yeah, thank you so much. If we could go to the next slide. Wonderful. And you'll see, I think, in many ways how my presentation builds on what the previous presenters have been talking about. So at the very beginning of the pandemic, in April 2020, Bill Gates released a very long manifesto, if you will, about how the world was going to get out of the pandemic. And for me, as somebody who works on communications, of course, I look for what he wrote about communications. And there was but one sentence, if we move to the next slide. And in that sentence, Bill Gates said, quote, "It will take a lot of good communication so that people understand what the risks are and feel comfortable going back to work or school." Now, for those of us who work in communications, we saw a lot of things that were quite problematic about this sentence, to name but a few. The idea that communication is only about the moment when one is at least notionally exiting from a pandemic. The communication was only about understanding risk. I think Robert's and Ashley's presentations in particular point to why there's a whole host of issues embedded in this statement. But it was part of what inspired me and a whole team to say, okay, well, let's actually look at how democracies around the world are communicating during the first 6 months of the pandemic and really try to tease out what we could learn. Next slide. Because, of course, good communications is sort of meaningless. What do we really mean by that? We posited in this report that communications were really a crucial NPI, that often many officials and others sort of thought, well, the NPIs are things like masking, distancing, et cetera, that actually communications really sort of underlies helping people understand those practices, their meanings, and so on and so forth. But the pandemic communications wasn't happening in isolation. It was intersecting with a whole host of existing crises, whether populism, the erosion of local journalism, anti-vaxxer activism, the changes in our media landscapes, and so on and so forth. So what we did in this report is move to think about what democratic health communications look like. What did it mean to have this happen in 9 democratic countries around the world? So we tried to make sure that we weren't just looking at Canada, but really trying to get a much broader global perspective, looking at Canada, Germany, Norway, Sweden, Denmark, Senegal, New Zealand, Taiwan, and South Korea. It was an interdisciplinary approach combining history, communications, political science, epidemiology, and also making sure that we worked with sources in the original languages for each one of those places. Next slide, please. So what we discovered in doing an in-depth look at the first 6 months of COVID communications in those places is that from that we could try and extract some basic principles of what one could do. We call them the rapid principles, also because one of the things we found was that the speed of official communications mattered. So I won't go through all of these principles. If you are interested in the report, you can go and look at it, tinyurl.com/democratic COVID comms. And there's a whole host of much more details. I don't really want to talk about R, A, and P today in the interest of time. I'm just going to talk about I and D, institutionalizing communications and describing them democratically, because I think Ashley and Robert have sort of talked about R, A, and P. Next slide, please. So institutionalizing communications, one of the really important things that we found was that in Taiwan and South Korea, there had often been assumptions that it was a quote unquote culture of mask wearing, which is why there was such a high adherence to ideas of things like mask wearing. And what we found in our research is that that is a fundamental misunderstanding of what had happened in those two places. In fact, what had happened was that in those two jurisdictions, officials had learned from failures, whether it was the first SARS outbreak in Taiwan or a MERS outbreak in 2015 in South Korea, where communications really didn't work. There were rumors, low compliance, not actually a huge amount of mask wearing, and a great deal of confusion and fear mongering. So what happened in those cases, in both of those jurisdictions, there was a lot of learning, reforms of the structures and institutions that responded to pandemic and epidemic emergencies. And in both cases, those legal and institutional reforms embedded communications as part of how those jurisdictions would respond to pandemics and epidemics, building on, again, a lot of the lessons that Ashley and Robert discussed, including in the case of South Korea, having mechanisms that could draw in, for example, groups of 50 citizens who could be giving advice and feedback as South Korea was pushing out various forms of communication, so having continual feedback loops. The important thing here was that these institutions, the actual capacity of communications, were in place and ready to go when COVID emerged in 2020. It is not possible to build those kind of connections with communities in 3 days. You need to build trust, you need to have time, and that means institutionalizing it beforehand. Next slide, please. So some of the strategies that there were taken on in a place like Taiwan, for example, was that Taiwan tried to follow the idea of humor over rumor. They felt that deleting disinformation was a form of censorship that would actually create distrust amongst the public, and that instead you need to use humor over rumor. This is one example where they talked about maintaining social distance by talking about the zhongchai, which is the sort of symbolic animal of Taiwan. Next slide, please. And they also tried to take the approach of involving citizens, pharmacies, etc., in what the digital minister of Taiwan, Audrey Tang, called radical transparency. This is an example of where, when they were trying to encourage citizens to use masks, but there were mask shortages, Tang built an open source map that showed people which pharmacies had how many masks. And every day, Tang would receive comments from the pharmacies, people who were using the map, etc., about what was working and not working with this map. I can't go into the details, but I can tell you more in questions if you're interested, and continually improve that map so that people could really tell where there were masks. So I think this is an example not only of transparency, but also of including citizens and being open to their comments and making sure that those kind of tools were continually improved. Next slide, please. And then just briefly, the D of describe it democratically. Some of what we found is that in places like South Korea, they really talked about this as something that was a relay race, that all of the measures that people were supposed to be taking, the meaning here was that every citizen was part of the relay. They were carrying the baton and they had to pass it on to the next citizen. And one of the other interesting things we saw in South Korea was that this kind of rhetoric, and it's hard, of course, to prove direct connections, but it's very interesting that the 2020 April elections in South Korea, basically the first major election that happened during COVID, actually had the highest voter turnout in 28 years of 66%. So that tying the sort of democratic responses to COVID seems somehow connected to actually people showing up to vote as well. In the case of New Zealand, they talked about a team of 5 million. Robert mentioned that we are in it together in Ontario, but that soon moved into more military metaphors, which we found in this report was sort of problematic because they seemed very authoritarian, top down. They started to create ideas of enemies, and unfortunately we've seen how that has morphed from the idea of virus as enemy to other people as enemies, which of course has been deeply problematic and divisive over the course of the past few years. Next slide, please. So the other thing that I wanted to spend my 10 minutes talking about was just to talk about a bit more specifics within Canada, because of course that report is trying to show what are best practices. And here I suggest there are a huge number of actually very positive best practices that we should learn from other countries. We need to move beyond the cultural stereotypes about why people are doing things in other places and recognize a lot of it is about institutions and very innovative communication practices that create meaning. But of course, over the course of the pandemic, we've seen one other, I think, really problematic aspect that has made all of this kind of work very difficult, and that is online abuse of health communicators. Next slide, please. So we've seen, for example, in a survey conducted by Nature, that of scientists who comment on COVID-19, nearly 60% have attacks on their credibility. We see 30% getting reputational damage, and over 40% of them experiencing emotional or psychological distress. So it's all very well to talk about communications, but we have to constantly bear in mind there are people behind this who are experiencing a huge amount of distress and professional reputational damage. Next slide, please. Just in case you were wondering if that was an outlier survey, Science also conducted a survey and found very, very similar results, that 38% of COVID-19 researchers were reporting some form of harassment. And if you look at this, you'll see that the vast majority of them are forms of online threats, whether it's through social media, but also we find in our research through email as well. So sometimes these threats are not visible to those of us who are researching social media. What we do in our research on online abuse is that we also talk to people who are involved in these kind of professions to really understand what it is that they're experiencing. That's part of how we know that email is actually a massive conduit of online abuse. Next slide, please. So one of the things that I and Chris Tenove have done over the last few months is look into the specifics of online hate and abuse of health communicators in Canada, particularly in British Columbia, for a report that was commissioned by the BC Office of the Human Rights Commissioner. We found 5 main themes of online abuse, most of them overlapping with conspiracy theories, many of which were also prevalent in places like the United States as well. Whether it's the sinister origins of COVID, the idea of corrupt elites, the idea that those elites are causing injury or death, the idea that freedom is under siege, or that these elites are incompetent. All of these conspiracy theories and disinformation in different ways and then tie into abuse of those health communicators. Often in the cases of women and racialized people, those are then tied to their identity in different kinds of ways. Next slide, please. And we also find that there are a huge number of potential effects, many of which are deeply concerning because it means that people want to withdraw from this space. So I'm not willing, for very understandable reasons, to try to engage in the kind of meaning making that all of us are suggesting. And so we find effects, of course, on people's psychological health and well-being. They're often doing this off the side of their desk. It's not necessarily their main professional obligation, and they're finding it's taking probably the largest toll for some people on their psychological well-being. The second thing is many of them worry about how it undermines their professional effectiveness. Thirdly, we find something called chilling effects. What that means is that it's pushing some people away from participating online, going on TV, et cetera, et cetera. Research on other arenas of chilling effects find that they disproportionately affect women and people of color. There's no reason that we would expect that to be different in the world of health communicators, though our research continues. And then finally, a lot of the health communicators themselves were really concerned that this was actually corroding debate between experts. And I see there was one question in the chat already about that. So actually, that was one of the key issues that a lot of the experts were concerned about, was that experts themselves were now engaging in this kind of polarized debate. And so they weren't actually able to speak to each other. And that was in turn, because it was happening in public arenas, creating a huge amount of confusion for the general public, exacerbating polarization. For example, when one health communicator might polemicize against another, it will be the followers who would then pile on, and they would be the ones issuing the death threats, the rape threats, etc. But there was some kind of responsibility of thinking about how health communicators themselves were perhaps participating in the corroding of debate. Next slide, please.
Heidi, we're just at about time. Okay, so you're on your conclusions here.
It's all good. Okay, so in conclusion, crucial to learn from other jurisdictions. Many of them have done much better than Canada. So let's learn from them. Let's do some of those institutional reforms. We've seen it really work for places like Taiwan, South Korea. And the second is we can't talk about misinformation without talking about online abuse. And the third thing is that while we often talk about addressing misinformation, I want to suggest that actually a huge part of this is learning how to provide high quality information and support those doing so. Thank you so much.
Thank you, Heidi. That is actually a great segue to go into one of the folks who's doing so, to use your term. And I can, as one of the people actually who is doing so, although only at the level of Ontario, not at the level of the world, as our next participant was, I could tell you that your points there about online harassment, the chilling effect, and frankly, the personal price that many of my colleagues paid for doing the work that they were doing was just, it's good that it's part of this and recognized as part of the whole environment for information. It's certainly created a meaningful amount of psychological distress, and I think has contributed in no small way to the kind of burnout that we're now seeing, even in clinical services. Because a lot of these folks are also clinicians. Moving from the analysis, which I think is really occupied, it's nice, we're bookending this whole series of panelists. We started with practitioners in Sturgeon Lake First Nation. We've gone through two different types of analysis, one at the level of communications theory and philosophy, which I think provides an essential framework for what we're talking about, and the other a live set of studies of communications in democracies around the world and very different types of democracies. And now we're going to bookend this back with the practice. And interestingly, having gone from tight community in Sturgeon Lake First Nation to about as far the opposite in scale as you can imagine, the planet itself. Our last panelist, and I'll engage with her really much more in a conversation. And so for that purpose, actually, maybe Harris, we can go into full screen. We don't have to share a slide because there are no slides at this point, if that's okay. I just want to introduce Gabby Stern. Gabby Stern is Director of Communications for the World Health Organization. She's based at the headquarters in Geneva. She's in charge of the organization's global communications strategy. She has a team of professionals. She serves as a spokesperson for the Director General of the WHO. Gabby joined the WHO in March of 2019 after more than 3 years at the Bill and Melinda Gates Foundation, based in Seattle, where she was Director of Media and External Relations. But before that, and this is kind of fun for me, she was a journalist. We were both at the Wall Street Journal. She spent almost 25 years at the Journal in various editing and reporting roles in the US and London and in Asia. And before that, started working as a journalist in Omaha. But she's born in New Jersey. And let's just go right to Gabby. Gabby, why don't I just start with a question to you, a general question about your impressions of what you've heard from all of our panelists thus far.
Thanks, Rob. Can you hear me well?
Yep.
Oh, good.
Yep.
So thanks to you and everyone, Rosa, and all the other panelists for including me. You know, as I was listening to the other speakers, I thought to myself, this is all so smart and I agree with it and it's things we should do. And then I thought, how on earth are we going to incorporate this into our work? Because on a day-to-day basis, communications, what we do in a department of communications, it's so fast-paced. It's so full of pressure. It's so varied. I mean, in 1 hour, we can be dealing with, you know, an Ebola outbreak, monkeypox, a food safety issue, COVID, something. And so I felt, and I do a lot of thinking about the lessons we've learned from the past few years of COVID. And, you know, I have a long list of my, you know, the things I think I've come to understand, the things I still need to explore, you know, what went right, what went wrong. And I think for me, as a practitioner, thinking about my team and then thinking about our colleagues around the world who also do health communications, how do you incorporate these lessons into the daily grind, and I think the answer is, and it'll sound silly, but I think it's kind of like one bite at a time. And I see that we're doing that here at WHO in our department, which is with each new thing we do, each new campaign or each new issue we're tackling, or even each new press conference or each new video we make, I see that when we're discussing how to approach it, what are our goals, who are we trying to reach, we're constantly referring back to, oh, when we did something similar in 2020 or in 2021, it backfired, or we didn't reach people, or we were something like that. So I'm seeing it happen organically, but I do think what the other speakers are doing and counterparts around the world is you're creating public goods that practitioners like myself will be able to implement going forward. And I would like to be part of that. And I would love to see researchers and students dig into different aspects of how WHO communicated and what we did that worked and reached people and had impact, and what we did that didn't work. I just want to add that WHO communicates in different ways. I run a group that does global communications, but then we also have colleagues in country offices. We have about 150 country offices. They communicate within their countries. We have regional communications colleagues. So it's quite diverse, actually. And of course, we communicate in many languages. I hope that kicks us off well. And I think you're hearing the signals. Sorry about that, but my computer is buzzing at me.
Let me pick up from that, Gabby, and get right into the topic of misinformation. So, I mean, obviously, you're operating not just at a global scale, but you have more heft than most of your communications counterparts, because the comms platforms that were, where misinformation was actually taking place also operate at the global scale, not at the provincial, state, or even national level. Do you have any thoughts to get right into the nuts and bolts of any of those lessons learned about how you actually address misinformation and what you guys may have done, or what you wish was on your wish list, or anything?
There are so many different kinds of misinformation, and it's so monstrous and huge and distressing, and there are no easy answers. The one thing I do know is you have to work with the tech platforms, with the social media platforms, with the search groups, and so on, with the search organizations, companies, because on the one hand, they are these amazing vehicles through which you can communicate life-saving information. On the other hand, they are these forums of misinformation, disinformation, dangerous propaganda, etc. And so what we did from day one of the outbreak in 2020 was reach out to the likes of Facebook, now Meta. So Facebook, Instagram, WhatsApp were key ways that people disseminated good and bad information. Google, Twitter, and many other platforms. And so we said to them, look, number one, we're going to be transmitting what we know through your platform, among others. We also had a massive press conference strategy where for a while we were doing daily press conferences. I think by the end of this year, we'll have done 300 press conferences during COVID. And we had one today, and they're all hosted by Dr. Tedros, the Director General. But I'll come back to that in a minute. On the platforms, so we said to them, on the one hand, you're going to be this positive force for getting information out to many people, many ways. On the other hand, you're going to be disseminating killer information, right? Information that will lead people to do things that will make them sick or die. And so you also have to step up and do a better job of filtering that information. And actually, many of the partners, many of the tech companies and social media companies did step up their efforts, but they could have done more. And we continue to this day to urge them to do more. And we'll continue, for the foreseeable future. I think one of the unfortunate things is that the disinformation is not only in the digital ecosystem. A lot of the digital disinformation disseminated from political leaders and other kinds of leaders. And it was really unfortunate and remains unfortunate that there were leaders around the world at local, state or provincial, national and geopolitical levels who decided that spreading disinformation would be good for their political ends or their whatever their ends were. And that added a really troubling layer to what was already a problem on the social channels. I mean, the social media channels, anti-vax information was already on the social media channels for years. But then when you had this overlay of leaders using their bully pulpits to spread dangerous health disinformation, it just sort of, it blew things up. So it was quite, at times I felt, and my team and I felt like we were living in a dystopia because we would know what was happening, but there was this alternative reality out there in the digital ecosystem, for want of a better term, that was the opposite of truth, the opposite of fact. And it was nightmarish at times. And one felt really helpless. And basically, you know, we enlisted as many partners, you know, VIP, celebrities, sports stars, people who wanted to help us, stepped up and offered to be the voice of facts and also the voice of, I spoke about this with you the other day, Rob. Really important that people spoke with humility about the fact that we were in a new outbreak. This was a new pathogen, new virus. People didn't know all that much about it. And to speak, and so we also pivoted into speaking about the journey we were on. So anyway, those are my initial reflections about this huge misinformation, disinformation problem.
That's a great setup actually for one of the kinds of sets or genres of questions that we got in. I'm going to be synthesizing and integrating questions that we received. And one of them is basically, you know, the premise of a lot of what we've been talking about today is that there is a message, right? And that there is a message. And then, you know, rhetorically, one of the key questions, do you just, you know, what mode are we in? Are we transmitting the message or are we trying to create meaning around the message? But the presumption is that there is a message. When in reality, and this is one of the questions that came in, the science itself and scientists, and not just scientists, because we're working with a very, if you will, to use academic language, a kind of interdisciplinary crisis, right? That stretched over everything way beyond just science and public health. That there wasn't one message. There were a bunch of messages because that were all legit because we were trying to figure out, in other words, the scientists were disagreeing with themselves for absolutely legitimate reasons that you would expect in the course of the process of discovery. So question to the broad group. So Gabby will move into sort of the broad Q&A if that's okay, of which you are a part. So I'm not putting you to one side. How do you incorporate scientific uncertainty, scientific debate into the kind of environment that we're talking about here? You know, where there seems to be real value and importance in having a clear message. Open to anyone who wants to jump in. Ashley, your camera just came on, and I see Heidi's just did too. So why don't we? And I see Robert just did too. So Ashley, why don't we start with you? If you had something to say, I don't know if you were just turning your camera on.
Sure. No, I'll jump in. Thank you. So I guess I think it's always sort of imperfect but I think this idea there isn't a single message is correct, especially thinking about those issues of scientific process. But I think so long-term, sort of talking more about the kind of consensus model that science uses to create scientific knowledge is important. In sort of specific messages or messaging, I think one thing that's helpful to think about maybe is it's not just a matter of taking whatever the scientific debate is, or the sort of issues in public health, and telling them to the public, but rather rhetorician Jeannie Fonnestock has talked about the process of accommodation. So what you're fundamentally doing is transforming the whole argument to really think about, what does that audience need to know about this? So, you know, you may not need to get into the nuances of mask efficiency, rather think about, you know, we know that it's probably likely a mask is going to help in these situations. So that's what they really care about. So while there are competing messages in science and it's sort of evolving rapidly, transforming that as opposed to thinking about translating that, I think is one way to kind of get around the complexity of the messages in science.
Right, right, absolutely. And I think that speaks to the kind of humility that Gabby was talking about. I know that Heidi and Robert jumped on, but we didn't hear much from Vivian. So Vivian, if you came on because you wanted to jump in, why don't we go to you, and then we'll go to Heidi and Robert.
Well, I just wanted to sort of raise the issue of, it's really important to actually have a conversation with the community. And I understand that you're talking about a much bigger perspective, but the community actually knows how to actually move it forward. And I guess I'm really wanting to encourage us to think beyond the box of the theoretical constructs and application to what works for them and how can they actually move it forward in ways that are meaningful to them. I'm a participatory researcher, so everything is about from the bottom up rather than the top down. And so I'm just wanting to raise the issue that there's sort of two ways to this: that which we give, or that which we encourage and support. And so I'm just wanting to provide a different look at how some of these messages actually came to be in the community.
You know, it's interesting. This is actually, as Gabby knows, because we were talking about this, I'm working on a pilot right now in the US on exactly this, and on developing a new model of stakeholder communications that will actually iterate and enforce what I wish we'd had in Ontario and we didn't. So, you know, putting to one side, but I wonder if, as I go to Heidi and Robert, I could introduce, because it's a nice segue from what Vivian was saying, I could introduce another dimension, then you can answer any of these in any way you want, but it actually also speaks to the points you're raising. One of the listening in questions that came up, you know, in the Q&A was, and this is in the sort of general sphere of how are you listening to the community? Robert, you were talking about associating information with values and meaning among your listeners. We live in an incredibly diverse country, and frankly, every country in the world at this stage of history is incredibly diverse. What single value, like how do you identify the value, and what if there are many, many, many different values in the same public, not even a national public, but a local public that you're speaking to? And I'll put that, maybe we can start with Robert, because that segues into something that he was saying, then we can wrap up with Heidi, you can pull it all together if that's okay. I know I'm juggling a little bit around with the order here.
Yeah, sure. So I think one of the mistakes I'm hearing kind of again and again and again is the obsession with the value of accuracy. So is the information accurate? Because accuracy is a nice way of getting us out, I think, of the problem, Rob, you're describing. So if I just have accurate information, I don't have to worry about what values my audience has, what they might hear from that information, how they might make meaning from that information. And focusing on accuracy makes the communication problem simpler, right? Like I don't have to worry about, Rob, that complexity you just introduced if I have the value of accuracy. So for me, like, we need to drop the obsession with accuracy. And I don't want to be too critical of Gabby's position, but when we think that right-wing politicians were intentionally spreading misinformation, that's the wrong criticism. What they were intentionally constructing meaning, like Trump knows what he's doing. He knows what he's doing. He wasn't just like spreading inaccurate information. Yes, that's one thing he was doing, but he was speaking directly to an audience that had a specific set of values, and he was targeting those values, amplifying them, like supercharging them in a certain way with a kind of rhetorical strategy. And there was no counter rhetorical strategy from the scientific community. So I'm not totally answering your question other than to say it's really complicated and really difficult, because yes, I think Ashley was saying some of this too, but like you have to have this citizen participation so that you know what matters to people, what their values are, so that you know how you can craft your messages so that they're responsive to that community. Conservatives know their audience really, really well. They know what words target and amplify emotions. They make subtle little adjustments to messaging to amplify those emotions. And I feel like progressive, liberal, scientific-minded folk just think, well, if we're just accurate, I don't have to worry about my audience's values. And like, that's kind of the mistake I think we're making. But Heidi probably has something much smarter to say about this than I do.
It's really interesting because in a sense, what you're talking about is very familiar to public health practitioners who are setting up public health policy, and it's the precautionary principle. But often, particularly with the novel pathogen, we're talking about scientists, often bench scientists, right, who are now in a position of having to communicate. And because they're not policymakers, the precautionary principle really has no place in academic research. There's no reason for it. And so this is almost the frontier that you're describing here. But I'll stop. I'm not on the panel. Heidi is. Heidi, over to you for on all that we're talking about here.
Sure. I just want to add two things. One is that a lot of researchers in rhetoric and other things have emphasized that the concept of authenticity is often more important than things like accuracy. So if we want to get ourselves out of this bind of why do people believe misinformation, etc., it's because the person who's conveying it is seen to be authentic in some way. It doesn't matter whether what they say is true or not, it's that they are seen to be authentic. And so I think that's an important thing for public health communicators to think about as well. What does it mean for a public health communicator to be seen as authentic? And sometimes that comes from that person's stance in the community, it comes from their expertise. There are many different ways to be authentic, but I'd advise thinking about that question of authenticity. It can also come from communicating with individuals in the public. Think about Jacinda Ardern during the short lockdown New Zealand, March 2020, would do a Facebook Live every day, always talking with different people from different communities, whether it was Indigenous children's musicians or female scholars, etc., to try to have conversations that created more authenticity around what was happening. The second thing that I would say is I think that we all missed a trick at the beginning of the pandemic in explaining how science works. And this would have required a bit of a leap, I think, for people, but it would have helped a lot. And that is to say at the beginning, listen, this is a novel disease. And what that means is it's new and there's a lot we don't know about it. That is the bad news. The good news is basically every scientist on earth is working on this in some way. And what that means is that our guidelines will change. And when they change, that will be a good thing because it means we know more. And that's at least one way to try and get us out of the bind of when guidelines change, everyone is accused of being a flip-flopper. So doing what I call the meta framework of helping people understand what's going on in this moment, what is happening, it would have required a lot of repetition, but trying to get a different framework on guidelines will change, that will be good. That means we know how to protect you. That means you know how to protect yourself. Great news. We know that, FFP2 and N95 masks are more important. And the final thing that I would say is I also think that we've placed a lot of emphasis on the communicators and not enough on things like workplace safety. If we had had better and simpler guidelines for workplace safety, that would have made a huge difference. If we had had more guidelines, for example, on product safety around masks, why are cloth masks still something that can be sold by massive clothing stores when they are basically completely ineffectual? That's not a communications problem in the sense of a Gabby Stern communication problem, but it's saying that communication can happen from many, many different places. And so that means it doesn't always have to be to a general public, it can be to businesses. I remember, going to various places during the pandemic in BC and telling them, actually, you need to turn the music down. And they did not believe me that this was one of the guidelines from British Columbia because the guidelines were so long that people hadn't read them. They wanted to do the right thing, but nobody had produced that one-page bullet point thing. What do gyms need to know? You better turn the music down. That's very different than from what another business needs to know. So I'd urge us to think about all of those places in which communication is happening as well. It's not quite part of the question, but I just want to emphasize that because I feel we really lost that aspect of conversation. And that also puts too much pressure on the public health communicators.
If we're in the last few minutes here, and I would love to bring Norma and Shirley back into the conversation, because it seems like, in a sense, we're on three dimensions in this discussion. There's the analytic dimension, there is the global dimension, And then you guys, Norma, Shirley, and Vivian, working with them, really saw how this was functioning inside a community. And a couple of things really impressed, well, a lot of things impressed me from what you were describing, but one was the role of the Moxon Telegraph, which I would love to hear a little bit more about. That is the flip side of the dangerous rumor mill in the social media platform. It's when people, well, I'm not going to say it because I don't know. So you'll tell us how that helped and what that meant. And the other thing is, you're talking about a high degree of self-reporting of COVID tests, which I've not heard about anywhere. I mean, in fact, it's the reason why we actually have no idea what the data are in Ontario anymore, other than for hospital admissions. So, and that, it seems to me, speaks to a high degree of community integration and trust, and something that would seem to be mitigating this information. So in the last few minutes, I'll just throw that to you, whether that or anything else you've heard, how this sits with your experience in Sturgeon Lake. If you'd like, I'm putting you on the spot, so it's really only if you'd like it. If you wouldn't like, then that's okay too.
Hi, it's Norma. No, I'd be happy to answer. First of all, there was two questions that they were in the chat. So one was what was the medicinal approaches were used to prevent coronavirus. We implemented our traditional medicines, and I can't really speak to the actual medicine that we use, but it's mobilizing the interdependence of what Creator has given us, the use of the plants and everything that was provided to us on this earth. So this is what addressing their emotional supports and their spiritual well-being and their connection, and making sure that we make available of those both approaches were available for them. So, and that's that was very important piece that addressing their holistic needs. And as you know, science don't really touch on the spiritual side of our well-being. So that being First Nations, we are spiritually grounded, and we want to emphasize the connection of emotional and spiritual and physical and mental health well-being, and we always look after that, the whole being. So the family structure, as you know, is quite different in our community. And when we were talking about the isolating, the overcrowding, we did our best to isolate them at their homes, but when we're not able to manage, then that's when we reached out to the outside agencies where they had isolation places were set up at the hotels, and though this is where we were collaborating with the province as well with our counterparts to make available for them, because it is easier to take somebody out to go and isolate outside than the whole family. So that's how we managed, and it was continued to be a struggle. So, and there are a lot of challenges with that as well. So in high degree of our data, we believe that our leadership have mandated that this data is ours, and we have a right to provide and capture and manage our own data. And now, as you know, that we're not adequately funded. We are only been funded federally, and then in some counterparts of our provinces, they have the tripartite agreements where the province kicks in, where unfortunately in Saskatchewan, we're not situated in that. So we take every opportunity to be self-sufficient and manage, and therefore we feel that the data is so important to capture, and that is our ability to negotiate and affect change, where we feel the research is part of it as well. And so that's why it's so important to work with Dr. Ramsden in this. And that's research has always been a vehicle for change for us, for policy, implementing policy changes. So we're not there yet, but we're saying that because overcrowding is a big issue for us, the money that we get for housing is underfunded. And so that being, overcrowding causes more COVID. And so that is what we're going to measure, and we're going to create our own story from that. And so we do have the ability to negotiate our leadership, and our Shirley can speak to that they have the right to manage their own data, so we could deliver services according to the need of the community. And so that's why we felt it was so important to have our own testing sites here and to be able to, for our community members to feel safe, and also building that rapport is very critical. And I agree with the previous talk presenters that we've been building rapport with our nation for over 20 years when we transferred our community. So now we're seeing the momentum, and so that's something that we feel that is so critical. And so in the mainstream, we have to think outside the box, and we do have our own traditional health system as well, where that is grounded from our cultural beliefs and our connection to Creator and Mother Earth. Everything is always interrelated, and so it is that we need to also appreciate and integrate our cultural practices. That means also our knowledge keepers who are experts on their, and medicine people who are experts in dealing with any diseases. It's not just COVID, but all of the diseases that we're currently plagued with. So I don't know if I can ask Shirley to add a little bit on that piece.
We're just at about time, I'm afraid, and I think we'll start to lose people if we don't jump. But I really want to thank you for that, because it was the perfect way to integrate all of this. And it's actually the perfect way to sort of also tie, what normally in this country, land acknowledgements have become rather pro forma, and that's better than nothing for sure, but it's always better to do it, I think, thoughtfully and relate it to what we're actually talking about. And in this case, in recognizing that this whole conversation has happened on traditional territories, wherever you are in Canada, the United States, Turtle Island, there are a number of things that we as public health professionals and public health communicators and public health researchers can turn our mind to as we think of the territory on which we're having this conversation. In this case, where we are in Toronto, this is the traditional territory of the Haudenosaunee, of the Wendat, and of the Mississauga of the Credit, among others, and obviously continues to be an important place for Indigenous people to meet, learn, and we're working on that space. But here are the things that as I turn to this territory, and I'm hearing you, Norma, that I'm thinking about, it really integrates in, I think, what we've been talking about through the whole thing. One, authenticity, right? That there are authentic relationships that any public health crisis sits in, and they're relationships with each other in our communities, and they're also relationships with our environment, with the land, with the air, with the water. Humility, right? This recognition that even if we have all the science and a great deal in the capacity to do genomic analyses of new variants and the capacity to do aerosolized testing and so on, we don't know, and we don't even know what we don't know. And so approaching this discussion with humility allows us to actually work together on, in addressing any public health threat. Three, radical transparency of data came up in Heidi's talk. It, I think, was embedded into what Ashley and Robert were talking about. It's very much what I heard as you were saying, as you were talking about, we own this data and we're making this available to our community, and referring obviously to Vivian's work with you in that regard. And that's also about ownership, owning the problem together. And finally, and this echoes, I think, what Gabby was also saying, but it really speaks to the holistic nature of the connection that you're bringing to us, Norma and Shirley, that when we are in a public health crisis, it is actually a journey. It might be a journey that lasts 5 hours. It might be a journey that lasts 4 years. It might be a journey that we think has stopped for a while, and then suddenly we find ourselves on the train again, witness measles, polio, God forbid, smallpox, who knows what is waiting in the wings. But it's actually a journey, and that if we approach it as a journey with all the humility that comes with the journey, we don't know when the plane will be late. We don't know if when we get to the hotel, we'll actually get the room that we booked, et cetera. Then that actually is probably the best rhetorical framework for us to approach this with. So I've taken way more than my time. I feel really blessed to have been able to wrap this up together. I'm sorry for those questions we weren't able to get to. But I hope that we integrated most of them, and I think we did. So I'll pass back over to Ruth to wrap up. And I want to personally thank everyone. I've learned a lot, and there's a lot of reading that I'm going to do out of this for my own practice. Ruth?
Thanks, Rob. I'm Ruth Hall. I'm just stepping in for Susan Law as she's on a temporary leave. Thank you, Rob, for doing a fantastic job at a really amazing webinar. Just so interesting and fascinating. Thank you. Just a quick reminder that the session has been recorded. It'll be uploaded to the CAN COVID website and our YouTube channel. So in case you'd like to re-listen, I know I'm going to re-listen several times. I think there's a lot of key messages that Rob highlighted for us, and to go back to those and listen ongoing is necessary. So thanks again for joining, and enjoy the rest of your day.
We would like to thank our speakers and the members of our network for their continued support and participation in Canada's pandemic response. If you are interested in learning more about CAN COVID or joining our Pan-Canadian COVID-19 Research Network, please visit our website at www.cancovid.ca.